the seat of the United States Surgeon General, traditionally reserved for career clinicians and public health administrators, is currently the flashpoint for a fundamental pivot in American medical philosophy. Dr. Casey Means, a Stanford-trained physician and co-founder of the health tech firm Levels, has emerged as the primary architect of the Make America Healthy Again, or MAHA movement. Her nomination in early 2026 to lead the United States Public Health Service follows a high-profile alliance between Donald Trump and Robert F. Kennedy Jr., positioning Means as the operative lead in a self-described war against the chronic disease epidemic. Her confirmation hearings have transitioned from standard procedural reviews into an interrogation of the very foundations of modern healthcare, focusing on her claims that the nation is losing its minds to dementia and depression while suffering from an unraveling of physical wholeness. The friction surrounding Means is rooted in a decades-long evolution of American health reform. In 1932, the Committee on the Costs of Medical Care first identified the rising burden of illness, yet for the next 40 years, the debate was confined to insurance and access. By the 1970s, the battle lines were drawn between President Nixon's market-based approaches and Senator Edward Kennedy's push for a national health insurance system. These historical efforts were almost entirely focused on the mechanics of payment, how to fund a system designed to treat acute illness. Today, Means represents a departure from this 20th century framework. Rather than debating who pays for the treatment of disease, she argues that the medical industrial complex itself is driven to ignore metabolic root causes, a concept that mirrors the social unionism concerns of the 1970s, but shifts the focus from economic access to biological integrity. The Means Doctrine operates on three primary technical levels. First is the metabolic framework. She posits that mitochondrial dysfunction, driven by refined sugars and seed oils, is the underlying driver of 80% of healthcare costs. Second is the regulatory overhaul. Means advocates for the reform of the National Childhood Vaccine Injury Act of 1986, calling for increased research into the cumulative effects of the CDC vaccine schedule, a position that breaks sharply with current CDC consensus. Third is the corporate divorce. She and her brother Callie Means propose a total decoupling of the FDA and USDA from pharmaceutical and big food lobbying. Her approach uses consumer technology, such as continuous glucose monitors, to bypass traditional clinical gatekeepers and provide citizens with direct, real-time metabolic data, a model she scaled through her company, Levels. The debate over Means divides the medical community into two rational but opposing camps. Supporters view her as a necessary disruptor. They argue that despite the United States having the highest healthcare spending per capita, life expectancy is declining and chronic illness is surging. For this group, Means is the first leader to address the broken hearts of a nation poisoned by its own food supply and over-medicated by a system that profits from sickness. Conversely, critics and traditional public health officials raise alarms over her lack of clinical practice and what they term science-poitation. They argue that her rhetoric regarding vaccine schedules undermines public confidence in the safest vaccine supply in history, and fear that her policies will lead to a resurgence of preventable infectious diseases. They characterize her focus on metabolic health as a quick fix that ignores the complexities of evidence-based medicine. The immediate future of Casey Means hinges on the Senate confirmation process. Under Senate Rule 31, her initial nomination was returned to the White House at the end of the 119th Congress's first session, requiring a resubmission in 2026. If confirmed, the first 100 days will likely see a formal push for the USDA to overhaul school lunch guidelines and a directive to the CDC to initiate longitudinal studies on cumulative vaccine loads. Beyond personnel, the market is already shifting. The success of her Good Energy platform has triggered a surge in the metabolic health tech sector, with companies moving toward preventative data. Whether she secures the Surgeon General post or remains an external advisor, her influence has successfully forced the metabolic health agenda into the center of federal policy debates for the foreseeable future.